Hi, assalamu alaikum, everyone. My name is Mariam Hussein. I'm the Vice President of IMANA, and I'll be the moderator for this talk. So, Bismillahir Rahmanir Rahim. Thank you all for joining our next installation of COVID-19 updates. Unfortunately, we're still very much in the middle of this pandemic, and we're still dealing with a lot of people who are getting infected and a lot of people who are unfortunately dying from this pandemic too. And so we here at IMANA and along with the Health Professionals Committee of the National Muslim Task Force on COVID-19, we still are holding these webinars to inshallah help people stay updated, especially with all the news that is going around. There's a lot of misinformation, disinformation that keeps going around. So we're hoping to be able to provide you with the most up-to-date, accurate information from people on the ground, expert physicians who are working on this stuff day to day. So I'm very happy to be joined today by Dr. Uzma Syed. She has been one of our rocks here at IMANA, helping to educate everybody from the beginning of this pandemic. Is definitely taking a lot of time, of her own personal time to help us do this. So thank you, Dr. Syed. And we're also joined by Dr. Asma Moheet. I'm very lucky to have her on as well. She's a native here of Columbus too. Well, not native, but here with me as well from Columbus. And she's a neurointensivist. So she will be able to help provide us a different perspective on COVID and what she's been seeing from, like a neurological nervous system type perspective. So if anybody has any questions, again, we're here on YouTube and Facebook and on the Zoom webinar as well too. So feel free to ask any of your questions, and at the end of the webinar, inshallah, we'll be able to answer them. And so without any further ado, I'll hand it over to Dr. Syed.
Assalamu alaikum, everyone. Thank you so much, Mariam, as always, for the warm introduction. And thank you so much to IMANA for all the tremendous work that the organization's been doing to really keep people informed and in the loop with the ongoing pandemic that we're in. IMANA does tremendous work nationally and internationally. And I think, we are really fortunate to have this amazing organization to provide all the resources to all of you out there. So a lot has changed and a lot has been the same since we've spoken previously. Some of the real tenets of, infection prevention and infectious diseases have remained with us throughout the start of the pandemic that we talk about every time that we meet. Our basic infection prevention measures are still in place and are still really much mandated, such as wearing a mask, washing your hands, watching your distance, the 3 Ws, and just, really avoiding indoor crowded areas with poor ventilation. We've seen lots of examples of these super spreading type of events. And as we are moving into the cooler months now, these are things that we really have to keep in mind for many of the states where the weather has been nice and people have been able to enjoy outdoors. Now, as we're transitioning to the cooler months, really have to keep these things in mind and keep the good behaviors in place and practices in place and model really good behavior for your children, for family members, so that as you're moving indoors, you're continuing to really limit the large crowds and continuing good practices with mask wearing. So I just have a few slides that I'm going to share. Let's see here. Basically, let's look at our, handy dashboard here that we've been looking at for months now. If we go back to the beginning of the pandemic, we were nowhere near these numbers. The red that you see everywhere is really quite alarming, but, we are now getting close to where, 8 months into this, and our cases are just growing, exponentially. In the United States, as you know, we are getting close to 8 million cases, globally 38 million cases. Global deaths have surpassed 1 million, which is really alarming rates considering that, it hasn't even been a year yet. And in the US alone, we've reached that milestone over 200,000 deaths, which happened. And unfortunately, that number keeps climbing. You can see throughout the world, actually, you have really significant disease throughout throughout the whole world, 189 countries being affected. And this grid over here changes frequently. And you can see that we are still leading. Unfortunately, we don't want to be known as the leaders in this pandemic, but unfortunately, we have real significant disease in our country and real significant mortality as a consequence. A lot of deaths we can see, but you can see that India has actually moved up to second place. Brazil was in second for quite some time now, and the cases are really climbing internationally. In the nation alone, we can see there are different regions that we have real significant disease burden in, but pretty much we can say that, throughout the US, the disease is pretty much prevalent throughout the US. And recently, what I'll share with you, the trends that we've been seeing is, in the Midwest, we're really seeing high reported cases. The Northeast, where we had our epicenter, where we had our surges in the spring, we've really been able to contain the virus, and there's been really low levels of virus transmission in our communities. And we're, for the most part, looking at less than 1%, positivity rates in the community, with some areas and pockets of higher numbers that, now we're seeing little clusters in different areas. And so they're trying to contain those areas. But in other states, you can see here that there are positive cases and rising significantly with 7-day rolling averages, really high in North Dakota, South Dakota, Montana, Wisconsin. You can see all these areas are really being affected. So for the last 7 days, we've had over 30 states that have been reporting increased number of cases. And it's, it is alarming because we are, in October, heading into November, December. We are concerned about what the timing of, the cooler months, the flu season, what is it that we are going to see heading into this kind of seasonal changes, and with the numbers already climbing, it is rather concerning to see these trends. If you look at the US, new daily reported cases went up 14%. Deaths went up equally by 4.8%. Hospitalizations went up by 5.6%. So if you just look at this grid here from March till now, we had lower, our cases had gone down a little bit for a little bit, and then now we're kind of climbing up again. And we were essentially anticipating this to happen, but it's kind of rising at alarming rates. So, it is really alarming, and it is concerning because it really is going to be up to everyone's behaviors and the kind of practices that people do in the next several weeks. And that's really going to determine how much more disease transmission we have in our communities. So I wanted to touch a little bit about what's happening with the updates with all the clinical trials and everything like that that's been going on. You have probably heard about all the vaccine studies that have been happening worldwide and within the US. So the clinical trials are really underway with different vaccine candidates that are being studied right now. They've gone through phase 1, phase 2, phase 3 trials are happening right now. And the latest development in some of these trials is that, most recently Pfizer has been given the green light to start enrolling patients in the pediatric population as young as 12 in their COVID-19 clinical trials. So, this has some implications because up until now, the vaccine trials were only enrolling adult patients. And, we do know that, COVID-19 does affect children. We know that it affects children less and certainly less significantly than adults, because for the most part, children we can see have been spared from significant mortality from this, with the exception of MIS-C, which we've discussed before, the multi-system inflammatory syndrome that we see in children. But the thing that's interesting about this is that we don't actually know how much of the pediatric population is affected by COVID-19. And that is because, we don't do surveillance of children, nationally, nor do we do it, really internationally. This is something that really has not been done yet. There hasn't been widespread just surveillance of pediatric population to see how much disease is really endemic in pediatric population. There was a recent study that came out in Science, actually, that looked at a very large prospective study, a patient population of contact tracing that was done in India, actually, in two major states, in Andhra Pradesh and in Tamil Nadu, which looked at patients that were affected with COVID-19. And they actually did some surveillance on the pediatric population, household contacts, and with their contact tracing. And they did find actually that kids and young adults and the pediatric population did have significant burden of disease, and for the most part, children do end up being asymptomatic or mildly symptomatic. So a lot of times this is sort of missed. So this would be really interesting because, we do want to study the vaccines. We want to prove that the vaccines are safe and that they're effective in the pediatric population. Without having that population in clinical trials, there's no way that we're going to be able to really prove that. So it's a step in the right direction, and I think a lot more clinical trials are being done in a very safe and effective way, that they're routinely done. And I think that's really what's important, is that they have to follow all the protocols, all the phases of the trials, with a data safety monitoring board in place, meaning that if there are any adverse events, if there's any complications, that it's looked at very carefully, and the trials oftentimes will be put on hold. So we can see that this has also been done recently. You may have heard about one of the clinical vaccine clinical trials, AstraZeneca, the other one, Johnson & Johnson, very recently, just up until yesterday. This trial was put on hold because there was a person who was enrolled in the clinical trial who had an adverse event. They're trying to see if it was related to the vaccine or if it was just coincidental. So when things like this happen, it's very, normal for these vaccine trials to really go in a holding pattern. People will hear about this in the news and assume that, oh, this means there's something wrong with the vaccine, or it's not safe, or, and just start having all these, notions that, the COVID vaccine, whenever it comes out, it can't be good because there's issues going on. Well, this is the way that science is studied normally. Any vaccine that's been studied in clinical trial, any medication that goes through clinical trials and gets FDA approval, it has to go through all these channels to make sure that it is safe in every single person, that it's effective in every single person. And this is very normal. So once something is reported, then they really put everything on hold, they pause the trial, and they try to see if there's a cause and effect relationship, meaning, was this from this vaccine or was it just coincidental? And until all that information is released, this is quite normal. So we will hear about this more now because COVID-19 is so prevalent and it's in the news. But this is something that healthcare workers, are used to hearing about. So it's not something that should raise a red flag until all of the information is out. If there is, in fact, some adverse event that is related to the vaccine, then usually it doesn't proceed, the vaccine doesn't go on to complete all the trials and does not then get FDA approval. So these are not unusual circumstances. AstraZeneca, like I was mentioning before, its clinical trial had, an adverse event that was reported as well. And since then, this trial has actually been on hold for over a month in the US. There's different phases being done with this trial in different countries, and some of those have resumed. But for the US, the trial here has still been on pause as of now. Now, I want to touch briefly on the monoclonal antibody, because I know that's been in the news a lot recently, especially after President Trump received that as his treatment. So just want to tell you briefly, this is one statement that came out from Eli Lilly that participates, that is one of the producers of the monoclonal antibody. But, there's different companies, pharmaceutical companies that are producing this. You may have heard about Regeneron, which is a company that's producing the monoclonal antibody. So just to give you a little bit of background, we've had monoclonal antibodies that have been studied previously with other diseases. They've been looked at they've been used for autoimmune conditions, for cancer, for other lethal viruses such as Ebola. So in 2019, there was a clinical trial that was underway for Ebola, which showed significant, reduction in mortality with these monoclonal antibodies. Just to give you a little background, Ebola is really lethal virus that has been around for some time now. And, the survival rate is only about 10%, just to give you perspective. And after treatment with the monoclonal antibody, they found that the survival rates had increased to over 66%. So that was when it was first shown to be effective. And since COVID-19 pandemic started, actually, they started working rather quickly on these monoclonal antibodies for the novel virus, SARS-CoV-2. So the way that the antibody works, it binds to the spike protein. You know, we often talk about the spike protein. You've probably seen the pictures of the virus with the little spike sticking out of it that gives it that crown-like appearance. So that spike is usually what's used by the virus to attach, to get into the person's body and cells and start replicating. So this antibody binds to that, meaning it attaches to that spike so that it prevents it from continuing to infect cells. So that's it in a nutshell. And basically, just to give you an idea, that this is the antibody treatment that's being studied right now extensively in clinical trials. So again, as I mentioned before, the only way to really know if a medication or a vaccine is effective is to really study it in the context of a clinical trial. So you have a very controlled environment where you can study the drug or the vaccine in controlled environments with people that are getting it and people that are not, and look at a very diverse age group and diversity in patients, you know, in gender, ethnicity, and everything, and to see, is there in fact statistically significant benefit from this medication, from this vaccine? Have you proven that it is safe and effective? So these are the trials that are being done right now, including the monoclonal antibody. Just some updates. You know, there were some neurologic manifestations that I think Dr. Moheet will touch upon a little bit as well. Basically, when you have patients that come in with different types of symptoms with COVID-19, confusion is something that is presented pretty commonly. And this one study recently had shown that it was shown to have worse outcome for these patients. And lastly, I want to talk really quickly about the multisystem inflammatory syndrome in adults. This is something that was very recently reported out of MMWR. And basically, you know, we had spoken previously about multisystem inflammatory syndrome in children. And this is something that was very recently reported. I personally actually diagnosed a case of this in May. And the patient that I had met all of the criteria for MISC, with the exception that their age did not fit. And I knew that there was something, you know, that this must be the case. And so basically CDC has gathered data from different institutions, a handful of cases from New York. There were about 27 reported cases so far of this multisystem inflammatory syndrome in adults, basically from March till August, where patients came in with atypical presentation for COVID-19. They did not have respiratory symptoms. They came in with fever. They came in with cardiac symptoms, meaning they had, you know, heart rate elevations. You know, my patient had cardiomyopathy, things like that. They came in with gastrointestinal symptoms, nausea, vomiting, diarrhea. They came in with a lot more skin manifestations. I had that case as well. And we saw this in the pediatric population, where they came in with these atypical findings, more like a shock-like picture, where they came in very sick, needed to be in the ICU, and needed really good critical care to really help them through this illness. Majority of these patients we saw in the pediatric population, they did not have the SARS-CoV-2 PCR was not positive for them, but then later they were tested and they had antibodies. A lot of that applies to this as well. Some of the patients did have the PCR positivity, but a lot of them had the antibodies that were positive. So really interesting, you know, they presented with the elevated inflammatory markers. A lot of them were treated with, like I said, good ICU care, where they had medications to help with their blood pressure. They received steroids. Some of them received immunoglobulins, so things like that. And for the most part, these patients did pretty well, actually, including my patient, who had complete recovery from this. And majority of all the cardiac manifestations actually have reversed on the patient that I was following. So this is really interesting, something to really keep in the back of our minds as we're heading into, you know, our cooler climates where we are, you know, our cases unfortunately are rising, and we are anticipating that we're going to have a lot more unfortunate COVID-19 cases. So, you know, everybody should sort of keep this in the back of their minds, that if they are seeing patients presenting with, you know, these unusual symptoms, that it does exist in adults as well. And that's it for me.
Thank you so much. Again, as always, Dr. Syed. I appreciate, thank you for going over all the vaccines as well too, and just the updates, because I know that can get a lot of really confusing for people. I guess just as a quick point before we go to Dr. Moheet, you talked a lot about the science of things. I liked how you brought up that, this is how science works, right? It's not very quick, but you do that so that people stay safe. I guess if you could speak to, again, being an expert in infectious diseases, if people had a choice between focusing on waiting for the vaccine versus focusing on prevention, what would you tell people right now?
Yeah, that is great question. And thank you so much for bringing that up. So, we are all, watchfully waiting, and, we are cautiously optimistic that, a vaccine, a good, effective, and safe vaccine is on the horizon. But we know that's not going to happen in 2020. We're not anticipating that happening this year. But something that people need to realize is that the vaccine also is not going to necessarily be the end of COVID-19. It is definitely going to help achieve that herd immunity that we talk about a lot in a safe way by, vaccinating people so we prevent, mortality and death. But our good infection prevention practices are here to stay. Our tried and true tested measures are still going to be very much valid. And we know what works. We know how to stop the transmission of the virus. We know wearing a mask works. It is very effective in preventing, the transmission, because we know even talking can transmit the virus, right? We know that keeping a distance works. We know that not being in certain environments where we have more potential of spreading, illness, or at least knowing who you're interacting with, knowing, who is in your circle, because you have to know what kinds of activities are they participating in. Are they participating in high risk activities, or are they being careful and they're also participating the way that you would be, with your immediate family and your household members? So these are all the things, especially as we're heading towards the holiday seasons and people start thinking about traveling and meeting with family and schools and things like that. And these things are not going to go away for the next, several years. Masks are here to stay. All of these measures that we have in place, I think people just need to really get comfortable with it. It is a little bit of an inconvenience, but at the end of the day, just think about how many lives are being saved for this little bit of inconvenience. And to really continue to have some sense of normalcy, whether it be, socially, economically, from a health perspective, any which way, we have to take a little bit of inconvenience to really have some of that balance and have some sense of normalcy.
Thank you so much. I think we still need to hear that, unfortunately, right? So, so thank you again, as always, Dr. Syed. So going on now to Dr. Moheet, because I think, again, with all the disinformation and the misinformation, sometimes people think that either things are being made up about the virus, or maybe it's not that bad still. And especially as we head into the flu season, or typical flu winter season, Dr. Moheet works in an ICU, and she works specifically with patients that have neurological or nervous system problems. And so I would also be remiss in saying too that Dr. Moheet also helped us out a lot too in the beginning with sharing a lot of information at IMANA and helping us to spread that information too. So without further ado, I'll give it over to Dr. Moheet.
Assalamu alaikum, everyone. I want to thank Mariam and IMANA, all the folks from those on the front lines to those behind the scenes that are making this happen and really kind of pushing this mission forward of educating all of us and helping all of us kind of stay on top of the most cutting edge updates to try to help each other get through this, and all the other wonderful educational programs you guys provide. So that is very much appreciated. I'm going to be talking, Bismillah ar-Rahman ar-Rahim, I'm going to be talking about neurological issues in patients that have COVID-19. I do want to give a quick shout out to a couple of my colleagues in neurocritical care. That would be Dr. Dengayich, who is the neurocritical care director at Mount Sinai in New York, Dr. Sherry Cho, who's at University of Pittsburgh and leading an international study on patients with neurologic manifestations of COVID and complications of that, as well as Dr. Praveen George, who's done a lot of talks around this, and you can probably access some of those online on YouTube and that sort of thing as well. So without further ado, I will tell you what is a neurointensivist anyway. I figured we could take a minute and talk about that. So a neurointensivist, as Dr. Hussain said, is an ICU doctor that takes care specifically of, or has a background specifically in taking care of patients with brain, spinal cord, nervous system injuries. We do take care of patients that are critically ill, on the breathing machine, very, very sick. And COVID-19 patients can be, as you guys have heard and seen, completely asymptomatic, not even know that they have the disease, a little bit sick, mildly sick, or very, very sick and needing to come to the ICU. And as a result of that, there's lots of different types of doctors who take care of COVID-19 patients for a variety of problems that they may have. So neurointensivists are the doctors that get involved, specifically when there's patients that have brain, spinal cord, nervous problems who are very sick and need to have some kind of care in the ICU. But with the pandemic, and especially in the early days and in areas where there are significant surges, sometimes an ICU doctor is an ICU doctor, and we will be taking care of patients regardless of whether or not they have brain or spinal cord problems, because we don't have the manpower. So another shout out to what Dr. Syed was saying about prevention being so important to try to keep people out of the hospital and try to keep people from getting that sick to begin with. One important consequence I kind of want to start our talk about in terms of how COVID has impacted neurologic disease is that we have seen that patients that have real serious problems are actually avoiding coming to the hospital because they're afraid of being exposed to the coronavirus infection. So what that translates to is someone may be having a stroke and they don't want to go to the hospital because they're afraid of being exposed to coronavirus in the hospital setting. But that kind of delay may lead to them not getting the best treatment available for whatever disease they've got. And something like a stroke, that's a very time-sensitive treatment. So one important thing that I will say is we, in the hospital setting, will do our absolute best to try to create a safe space for you to get that emergency care that you need. So please don't delay if you or someone you know needs help in that scenario. Please do seek medical attention for that. So we're going to address a variety of different neurologic manifestations of COVID-19. And the one that's kind of the most commonly talked about and was identified very early on was one of these cranial nerve problems. So the cranial nerves are nerves that come out of the base of the brain and then go to different parts of the body. There's 12 of them. They have a variety of different functions. The ones that we heard about most commonly, the problems that we heard about most commonly in the early days with COVID were sudden difficulty with smell and taste. So anosmia is a problem with smell, and dysgeusia is a problem with taste. Maybe linked because sometimes we taste based on what we smell. But what we learned that in Europe, they described that actually this was upwards of 80% of some people's presenting symptoms. Did get better over time, usually over weeks. Most likely was caused by some entry or damage to the olfactory nerve. And the olfactory nerve, you can see kind of based on this picture, is right there at the base of the brain. So as the virus enters the nose and kind of goes up, there's some tissue that's very close to where the entry route is that may be impacted by the virus. And that's why we may be seeing these problems with smell and taste. Another problem that we see pretty commonly across the board, and this has been described on almost up to 65% of patients, is encephalopathy. And for the non-neuro folks and the non-medical folks, encephalopathy is a general term for brain dysfunction. Encephalopathy can be slowing of brain functions from infections, from fever, from medications. If you think about someone taking a sedating medicine, that can cause encephalopathy. And other problems like your organs not working properly, like your kidneys or your liver. Encephalopathy is really common in patients with severe COVID disease, and reports have a big range depending on what patient population you're looking at. But in the sick patients, we think it's about 2 out of 3 patients have some problem with how their brain is functioning in the context of COVID. Patients may get a variety of tests to look for causes, and mainly to rule out other causes like organ dysfunction, as I was talking about with kidneys and liver not working properly. So that may be blood tests, there may be brain imaging done, CT scans or MRIs of the brain, testing the spinal fluid to make sure there's no infection there through a procedure called a lumbar puncture or spinal tap, as well as looking for things like little hidden seizures. And we'll talk about those other couple things in a few minutes here. One of the kind of most extreme manifestations of encephalopathy is what we call hypoxic-ischemic encephalopathy. So breaking that down, severe COVID-19 disease leads to low levels of oxygen in the blood. And the brain is dependent on oxygen for normal function. Most of the oxygenated blood that your heart pumps out is destined for the brain. The brain is very greedy, and it needs that oxygen. So prolonged low levels of oxygen start to cause problems in how the brain works, and you get that slowing down of brain functions and encephalopathy. You can also have what we call delirium, which is fluctuating levels of consciousness, alertness, orientation, being aware of where you are and what's going on, and pretty much looks like somebody is confused. And it can be something where they're agitated and very angry and hyperactive, or very depressed and what we call hypoactive. But this is one of the additional different ways that encephalopathy can manifest in COVID. Severe prolonged drops in oxygen or lack of blood flow to the brain, say somebody gets sick enough that their heart stops for a period of time, even if their heart is able to be restarted, if that lack of blood flow and that lack of oxygen to the brain was severe enough and long enough, that can cause permanent damage. So that's another kind of aspect of all this that we attribute to a consequence of COVID infection. One thing that's been talked about a lot in our corner of the world as neurologists and neurointensivists is how many strokes we're seeing in this patient population. So in general, a stroke is a very general term. All it means is that you are struck down, you have a sudden loss of function due to a problem with blood flow in the brain. And this is generally one of two ways. There's usually a blood clot starving the brain of flow downstream, or a ruptured blood vessel that leads to bleeding. And how it looks is someone can be fine 1 minute and the next minute lose their ability to speak, their ability to understand. Maybe they're paralyzed and they can't move one side of their body or the other side of their body or their face. And maybe they have some numbness on one whole side of their body or their other side of their body or their face. And so as a result, we can have, different ways that this sudden onset of either starving of blood flow to the brain, starving of the brain due to lack of blood flow, or a ruptured blood vessel can negatively impact how the brain functions. So this is just a quick picture looking at, on the left side of the screen, you'll see the two different types of strokes. So in one of them, you can see that this wall of the blood vessel is kind of blown out there, and then blood leaks out into the brain tissue. Or in the second picture, you can see there's a clot there where blood isn't flowing where it should, and it starves the brain downstream. So the important thing that we say that you need to remember to recognize a stroke is be fast. And what that stands for is these are different manifestations, different ways strokes can look. B being loss of balance or coordination. E, trouble seeing out of one or both eyes. F is facial weakness. You can see that guy has a little bit of a droopy face on one side. A is arm weakness. S is speech difficulty. And then T is time. So it's very important to call 911 because, as I mentioned to you earlier, certain treatments are very dependent on time. So that's just a quick overview of kind of what we see when we're talking about patients that come in with strokes. What we have seen is that up to 6% of hospitalized patients that we know of with COVID-19 may have a stroke. In New York City, there was a report of major strokes in 5 patients that they found younger than 50 years old, and 2 of these patients had no COVID symptoms but tested positive. So that was kind of raised a red flag to us that we have young people, people younger than 50 generally don't have strokes if they don't have risk factors for them. But they were starting to see more and more of these. And we're not exactly sure what happens. We have a couple of different theories. These strokes may happen because the blood, because of that systemic response, gets stickier when patients are sick. There's more clotting happening, or that the generalized inflammation, as Dr. Syed was referring to, that triggers some pathways that then cause the inflammation such that the body is putting chemicals out there that make the brain more likely to have a stroke and can directly impact blood vessels. So testing to figure this out may include an MRI scan or a CT scan. And again, if this happens, time is of the essence in terms of treatment. So it's very important to get into the doctor right away. Other problems that we're seeing are encephalitis. Encephalitis is a term for brain inflammation, and meningitis is the term for inflammation of the coverings of the brain. There have been some rare reports of brain inflammation in patients who have COVID-19, but this is rare and not commonly reported. And it's tough to know what the real numbers are. This may be that we are underreporting because we're not testing people as much as we usually would for a variety of reasons. Either they're too sick to show obvious signs that they have some sort of brain dysfunction. You know, they're very sick, they're on the ventilator. They might be on a lot of sedation to make sure their breathing is comfortable on the ventilator. So you can't really tell how their brain's functioning under there. Or that we think there might be something going on, but because it is a risk in terms of doing a procedure where we go in with a needle into the back to drain some spinal fluid, that folks aren't doing that as commonly as maybe they would be otherwise in something that wasn't as contagious. So generally speaking, it's rarely reported, but we think it's probably underreported. Another problem that we see is what's called CNS demyelination. So just like when you have electrical wires and they have this plastic rubbery kind of coating over them, myelin is the insulation that covers the nerves. And some rare patients with COVID have gone on to have a condition where there's breakdown of this coating in the brain itself, and that's called ADEM, or acute disseminated encephalomyelitis. That can actually happen after, it has been described to happen after a variety of other viral illnesses. We are seeing it in the setting of COVID-19 as well. And then acute necrotizing hemorrhagic encephalopathy. This was actually probably the first severe reported complication in this country. And this is a bleeding type of tissue breakdown in the brain as a consequence of infection. Again, pretty rare, but it is a process by which COVID is impacting the brain. And seizures. So seizures, as we alluded to kind of earlier on, people may be out of it because they are having what we call subclinical seizures. So seizures, as you may have heard described or seen on TV, are often shown as generalized kind of shaking, jerking movements of the whole body, and somebody passes out and they might be foaming at the mouth and that sort of thing. There's also a type of seizures that result in the person just not being as aware, being confused, having blank staring, or maybe just very subtle findings. And the only way to detect that is to hook them up to EEG or electroencephalogram to take a look at what the brain activity looks like and what the brain waves are doing. EEG gives us a lot of good information. It can show us whether there's a slowing in the normal rhythm and pattern of the brain waves, or if there is some rhythmic discharges happening that clues us in that maybe this person is having some little hidden seizures, and maybe we need to treat that and see if that helps them wake up a little bit more, be a little more coherent. So this has also been described relatively recently. Again, probably under-recognized because we are not hooking everybody up to EEG, sometimes because we don't have the resources to do so, and sometimes because the patients are so sick and so sedated to begin with. And then the other big category of problems we're seeing is neuromuscular problems. So in the ICU setting in general, people who are sick and who've been sick for a while can have severe weakness that affects all the muscles in their body just because they're so sick, because of the inflammatory responses they have, and also because they're not moving around. So you have this deconditioning happen where your muscles just get weaker laying there and you kind of waste away a little bit. We call this critical illness neuropathy and myopathy, and there's a couple of different tests that they can do to check for muscle breakdown and that sort of thing. The other thing that is happening with COVID is we're seeing more and more reports of AIDP or Guillain-Barré syndrome, which is a syndrome where, remember, we talked about that myelin, that covering of the nerves. This is demyelination in the peripheral nervous system. So when the nerves leave your central nervous system, leave the spinal cord to go out to the rest of the body, that myelin breaks down, and that can lead to impaired transmission of the nerves signals and lead to weakness. We have known that GBS happens after infections and viral infections, even prior to COVID, but we are seeing it in the setting of COVID more and more. Weakness due to either of these things, due to critical illness neuropathy and myopathy, or due to GBS, can be severe enough to impact breathing, such that people need a breathing tube placed and need to be on the breathing machine, or it's hard to get them off of the breathing machine once they've been put on. And so that kind of draws out how long people stay in the ICU and what kind of care they need moving forward. And sometimes people may even need to be on a ventilator for a longer period of time, weeks or months, and need a tracheostomy, which is where they move the breathing tube instead of going down your mouth directly into the throat. And then this last slide I wanted to show, this is again courtesy of my colleague at Mount Sinai. This is talking about patients who were not hospitalized and had COVID-19. So they took a look at this with their group. And what they found was that there are lots of chronic symptoms that are ongoing, even in patients that have had COVID-19 but have not ended up in the hospital. And what I wanted to point out was over here, kind of on the left side, you can see anxiety, concentration, cognitive difficulties, difficulty smelling. There's still a certain proportion of patients that are still having those problems, even though they weren't sick enough to end up needing hospitalization. So in summary, what I want to say is that this is a disease process that we're still learning a lot about, and we know we're learning a little bit more every day about the acute complications and the major problems when patients are hospitalized, but I think it remains to be seen how people are going to recover, how their concentration and memory and thinking and ability to bounce back from a neurologic standpoint is going to be affected once they come out of the acute phase. And there was recently a friend of mine who's a physician recently here in Columbus recently sent me an article about how patients describe this as having dementia. They feel like they have this brain fog even after they've recovered from COVID. They just can't think clearly. They can't get back to what their usual activities were. So again, you know, the key being do what you can to prevent it. And hopefully as time goes on and we get better and better at identifying and early treatment, we will see the needle move on some of these things. So finally, just one last reminder that what I started my talk with, that patients with real serious problems are not coming to the hospital because they're afraid of being exposed to coronavirus, but delays lead to not getting the best treatment and ability to recover in sometimes certain time-sensitive situations like strokes and heart attacks and that sort of thing. So bottom line, if you have an emergency, if your loved one has an emergency, please do come to the hospital. Don't think twice about it. We will take precautions to try to keep you safe. There's a few references there for the physicians and other healthcare professionals. This paper on neurologic complications of COVID-19, although it's a couple months old, is still a pretty good read. And then there's new things obviously coming out every day. I would encourage you all to follow the Neuro-COVID Consortium as they start putting out more and more papers in the next few months about they're an international group that's studying the neurologic effects of COVID disease and how it's manifesting in our patients. So with that, I will stop there.
Thank you so much, Dr. Moheet. That was a great overview of everything you've been seeing and unfortunately everything that people have been undergoing. I guess could you, just a real quick question, what kind of time frame are you seeing that people are having to be stuck in the hospital? If they are in the ICU, let's say, for example, or intubated, how long are you seeing people stuck there?
It's really variable, I think. You know, if someone at the most severe end of the disease, I think people can stay in the ICU for for weeks at a time. Sometimes they can be in the ICU for a month and then be in the hospital, until they recover a little bit better. The folks that either don't end up needing the ICU or just come to the ICU for a couple days of observation, sometimes they turn around quickly and they can be in and out of the ICU in a few days and then out of the hospital. So it's really variable, and I think that's what scares us on the ICU side of things, is that with the exception of a couple of risk factors that we've kind of consistently identified in terms of weight being one of them, so obesity, and existence of concurrent medical problems like pre-existing lung disease and other, older age and that sort of thing. There's very few things that give us any sense of security in predicting how people are going to do. We are scared by the fact that we can't really predict this is the person that's going to end up intubated and very sick, and this is the person that's going to do just fine. And so with that comes a lot of caution.
And kind of like how Dr. Syed was talking about, that obviously the way that science works is that, it takes time, right? And then to be able to say that is something connected to this, or is this treatment going to work? Just as someone who's dealt a lot with neurological problems, would you say that we have a very good understanding of what COVID does, or is there still more that you feel like is out there that we still don't understand yet?
Yeah, I think we're just kind of scratching the tip of the iceberg, really. It took us a while to even understand. People were reporting this taste and smell thing, and we were like, what? How is that possible? Mm-hmm. How is that happening? It must be connected to the brain, and then, it must be the olfactory nerve and that sort of thing. So we don't completely understand yet why these folks are having more strokes and the timing of when they're having more strokes. So we have a lot of theories. I don't think we totally understand all the different ways that the disease can be impacting us from a brain and nerve function, and that's why I look forward to the results of this consortium, this international consortium on neuro-COVID that Dr. Cho actually at UPMC is leading. So it will be, I think, in the months to come, very enlightening for all of us.
Inshallah, yeah. No, again, thank you. Both of you ladies obviously presented really important information that people need to hear. And it sounds like, we're still dealing with this problem. It's not going to go away anytime soon. And as you said, right, we're still scratching the surface as to what are the problems COVID can cause right now, and then also what can it cause in the future. And the future, as Dr. Syed said, right, we only are 8 months into this, so we don't even know what 10 years, 20 years down the road means. So if you all, we're almost at the hour mark, but if you could say, one message you wanted people to know from the experiences you guys have had now over the last 8 months, what would you like to tell people? Dr. Syed, if you want to go.
Sure. First. Yeah, I just want to touch a little bit on that great presentation, Dr. Moheet, just, the cognitive aspect of, there's so many neurologic manifestations that we've seen. I think the thing that's so fascinating and crippling at the same time about this novel virus is how it affects every organ system, and how, it's really a respiratory virus that has, all these significant, impacts that we have never ever seen before. And I personally have seen lots of patients with a lot of these neurologic manifestations. And I can tell you that, the cognitive decline is very real. I've had many patients being brought back in by family members that are just saying that their loved ones are not the same, and they keep getting readmitted to the hospital because there's something wrong, there's something new going on, and there's, after the entire workup, there's in fact nothing. It's just that there is this sequela, this consequence of having this virus, so this virus is like no other virus we've dealt with before, and we will continue to learn so much more about it. Another point that I wanted to talk about is the long haulers that we hear about, frequently. People don't understand, sometimes there's this tendency for younger people to feel like they're invincible and that, this is a disease of the elderly and it's only the elderly that are going to be admitted to the hospital and, require the ICU and maybe require a ventilator, maybe even die, Personally, I've seen many young people that have succumbed to this without any underlying medical conditions. So it really is a reality. And I have lots of patients who've had, significant disability because of this illness. I've had patients who are marathon runners who can't even walk half of a mile anymore. People that are still struggling with heart racing sensation, palpitations, people who have had cardiomyopathy, as I mentioned before, their cardiac function is not the same. They had their lung capacity is not the same. They feel short of breath. They're fatigued all the time. They can't function. These are things that are going to impact your life, profoundly. So I think, and these are young people that it's happening to. People might have heard about the Big Ten athletes, how many of them tested positive and had cardiomyopathies. The lifespan of an athlete is, there's a finite amount of time where they have that, their career and their, expectancy. And so, to think about that and those implications, I think it's really important that we really focus on ways to prevent this virus, because this is not like any other virus that we've seen. This is not your regular run-of-the-mill cold. These are not, the implications from this virus is really severe. And I think it's really important that we keep continuing the messaging that young people understand how severe this virus is. Even if you feel okay right now, you don't know what that means down the road. And I think that's something that we're seeing with the long haulers and the complications that they're having, lingering on.
Absolutely. Thank you. Dr. Moheet?
Yeah, just to, I agree 100% with everything Dr. Syed said, and just to kind of dovetail on that, I would add, the unpredictability is what scares us on the ICU side of things, just like Dr. Syed was saying. We cannot predict, who's going to go down and get very severely ill or even die from this. And we have all seen cases of folks that are very young, very healthy, productive members of society. And in the news recently, you may have heard about the resident, the OBGYN resident in Texas who passed away. There is so much uncertainty surrounding this and who is going to succumb to this, that it's really humbling to know that if we take certain very simple precautions, that we can prevent this from not only impacting us, but our loved ones, our communities, our families, and it's very easy. Safe hand washing practices, wear masks, don't go out unless you have to, keep a distance when you do, don't practice those kind of high risk activities if you don't need to be in an environment. Don't make that sacrifice for the sake of your health or others' health who you may be an asymptomatic carrier and not realize it and spread it to someone, and then they will end up very sick or dying. So I would just stress again, as Dr. Syed alluded to, there's very, very basic preventive measures that we can all be taking, and we should continue to stay vigilant on that, especially as we head into flu season. And we are going to see an extra strain on our hospitals and our ICUs that are now going to have to be dealing with, we expect to, I should say, see a strain. I hope I'm wrong, inshallah, I hope I'm wrong. But we expect to see a strain on our hospitals that are, in our ICUs, that are dealing with patients that have severe flu as well as COVID. And I think that's one thing that we're all very nervous about in the months to come. So please continue to do what you can to stay vigilant and keep each other healthy, inshallah.
Yeah, thank you for that honest take on it. And, at least that's something that we can at least forecast, right? If not predict, at least forecast, what could happen as the winter months come through. I want to just say a quick note that, for everyone who's been struggling after these hurricanes, currently with the wildfires as well, too, people who are suffering from economic issues as well. It's hard enough to worry about a pandemic or to get sick and to have all these other things going on as well, too. So, we're praying for everyone during those times as well. And a quick note to what IMANA does in general, that a lot of the places that we serve at internationally, if you can imagine that it's difficult here in the States, where alhamdulillah we have a lot of resources, you can only imagine how different refugee populations are handling this, and what resources they do not have access to. And just the complications that Dr. Moheet and Dr. Syed discussed, that a lot of these places don't even have ICUs, or they don't have access to these medications. So like Dr. Moheet said, that, wash your hands, socially distance, wear a mask. But if you want to do a little bit more, consider, donating in some of these organizations that help with these different causes, and especially for those communities that are suffering right now. IMANA, obviously, we still are continuing our work as well too. So any donations to help us continue this work, because like we said, we're in this for the long haul too. Inshallah, we will continue to provide information for everybody, hopefully inshallah on a monthly basis, if not every other month. And we want to make sure we don't just have these webinars for the sake of it, but we actually have important information to give everyone. So again, thank you so much to our two amazing speakers. Very privileged to have you guys here and to have your expert advice on all of this. So inshallah, I hope everyone has a great night. And then inshallah, we'll see you soon in about a month or so.